Thank you for the invitation. My predecessors before me have already talked to you about the market and the hernias and the problems. We approach the hernia problem from a perspective of pain and recurrence. So what we're eventually shortly going to bring is a tension-free fixation device. We know that most IPOMs, intraperitoneal onlay meshes, laparoscopic approach meshes, are performed with a tacking device. And the tacker works by placing single interrupted tacks throughout the abdomen around the mesh, securing in a position. There's a number of ones out there. And ultimately, they kind of all work the same. They cause a involution of the tissue. And if you've done them, you see this bucket, this bridge as you go along. And that's the pain that the patients feel. And if you do these kinds of cases, you know that the patients have a lot of pain. If you do transfascial fixation, they have a lot of pain. With robotic systems, there's been an attempt to try to reduce the pain, though there's not really much data on that. And what we believe is that the pain is from the tightness and the method of fixation. So what we are developing is a fixation device that uses simple interrupted sutures that are tension-free in the goal of approximating the mesh to the tissue without strangulating the tissue. It's a single device, currently disposable. It's a one-button activation. This is an animation of it. It uses a single reloadable cartridge that has adjustable suture length based on the intent device. Whether it's an inguinal hernia or a ventral hernia, we can alter the suture cartridge to give that device. The device with a single button firing has a needle that extends from the tip of the device and extends about 5 millimeters of depth of penetration into the tissue. This is a little video schematic of it working. You can see that the needle advances through the mesh, the tissue. The suture advances through the needle itself. This is all occurring inside the device. There's a heat mechanism that bonds the device, bonds the suture, and then cuts and releases the suture, leaving a simple interrupted suture loop that's polymerically bonded inside the abdomen. So what we know and what we believe is that we can achieve all of the benefits that a tacker has: the ease of use, the speed, the reproducibility, but we can do it in a tension-free manner using sutures. So we get better depth of penetration, we get cross-sectional depth of penetration, we have superior fixation strength because we're using suture. Right now, our device is designed with Ethicon PDS suture. Ethicon not specifically involved in this. This is just what we're using as off-the-market suture right now in our benchmark studies and trials. But we can adapt the device for any off-the-market absorbable or non-absorbable suture simply by modifying the programming in our bonding device. So what is our clinical trial so far? So we have, what we wanted to do was compare our device and its mechanics to current fixation devices like tacks. And so this is a very brief slide, but it says a lot about what our device is going to do in the future clinically. The x-axis is movement and the y-axis is force acting on a tissue. What we did was we secured a piece of mesh to pig fascia using tacking devices or using our device, and then we turned or we stretched. So we mimicked human motion of turning or moving, bending over, and having mesh pull. And how does that affect a person? And as you can see that our mesh movement, that the tacks are in the blue, from a very small motion, the tacks achieve maximal force gradient on the tissue, and then there's a maximum point, and then they simply give way, and they break apart, meaning that the mesh now pulls off the tissue. With our device, it takes a lot more motion and a lot more across the spectrum before we start to experience force on our sutures. So what this translates to in human clinical experience, we believe, is that the ability for the person to move, bend, twist, without feeling those fixation stitches. And that's where we think that's going to be a reduction in clinical pain, but we also believe that it's going to reduce clinical recurrence, because we believe that that time that that patient coughs in the recovery room or sneezes on postoperative day 1, that's when they might pull their mesh away, because that's when they supplant the 18 millimeter of mercury maximum tensile strength of tacks. This is a little, again, summary video schematic of the device in work. I'm not sure. Still have a couple minutes left, so we'll let it play there.
You're actually 2 minutes.
Oh, I'm sorry. And so again, we have a replaceable cartridge that you can add if you wanted more suture, or the cartridge that can be designed for the device. So that's basically it, a standardized method of fixation. We anticipate our market share is to replace all tackers. That's what we're going after. We don't see any role that a tacker would have superiority over our device. So.
Thank you.